Great, yep. So this is a presentation and it's designed to be really interactive. So I hope that it's interesting for you guys. You can use your mic to answer the questions, but if you're feeling a bit shy, feel free to use the chat. That's also okay. There will be time for questions at the end, but if you have any questions throughout, feel free to just chime in with them as well. My presentation is going to be on the emergency management of an unwell patient. So I hope that this will give you a bit of a taste of the sorts of things that you'd learn at medical school. And we're going to have a bit of a case-based learning thing going on. So we're going to have a patient that we're going to talk about. There we go. So the scenario is you're a junior doctor. So we're skipping forward about 10 years or so, bear with me. And you're in the accident and emergency department and a patient collapses. So what should you do? Does anyone have any ideas?
Call for help.
Very good. That's the one people forget to do, but it's absolutely the first thing you should do. So you call for help, and luckily you're in a hospital, so lots of very useful people will come running towards you. Does anybody have any other suggestions of a management approach?
Check for a pulse.
Check for a pulse.
See if they're breathing. Very
good. Yeah, these are really good things. Anything else? Well, I think that's pretty good. So those are really good things to do. And without even knowing it, you have actually said some of the steps of the ABCDE approach. So this is a standard approach for assessing and managing a patient in an emergency situation. As you can imagine, sometimes these situations can be quite scary and they can be very stressful. So if you are a doctor and you're on call and it's 3 a.m, you're 8 hours into your shift in the middle of the night and your brain is a bit dead and you get called to see someone who's had, say, a heart attack, every single doctor can fall back on this approach, and it's a really, really basic structure that as long as you follow it methodically, you'll know that you're doing the right things for your patient and you can be confident in that. So does anybody know what any of these letters would stand for? Does anybody have any guesses of that?
A is for airway.
Yeah, correct.
B is breathing and C would be compressions.
Very close. So B is breathing and then C is circulation. So compression definitely comes into that. Any guesses at D and E? They're a little bit more tricky. No. So we've got airway, breathing, circulation, disability, and exposure.